Dr. Arjun here with Spine Scammers Exposed, another segment. And today we're going to talk about some of the dirty little secrets in the spine world. And there are a lot of them. One of those secrets that people need to be aware about are what are called kickbacks, which is basically money given to surgeons that do spine surgery in exchange for using, basically screws and rods, the kind of things that we go putting into people's spines. And why this is important? Well, first of all, let me bring up an article. So, just came out 2 days ago, spine device execs charged in bribery scheme. So this has been published, and it's basically a well-known thing that goes on around the world where very big-time spine surgeons that are doing a lot of spine surgery, including putting in screws, rods, and metal, where they could get a kickback from the companies that manufacture the screws, the rods, and metal, or distribute them. So there's a manufacturing side where these things are made, and then there's a distribution side where they're distributed to all the hospitals so surgeons can use them and put them in the spine. So one of the biggest problems that's going on in the United States and worldwide, as a matter of fact, is these spine surgeons that put in all these screws and rods into people, and I'm just going to use this as an example, well, they're getting kickbacks from the companies that sell these things, and those kickbacks are illegal. They go against laws that are federal laws, like the Stark Law and the Anti-Kickback Law. And so what's happening in this article, you can see, we're going to talk about in a minute, is there are surgeons and the distributors of the implants who got caught from one of the companies, and now they're all basically going to go to jail. But the person that suffers the most is the patients, because you're getting basically unnecessary surgery with fusions or artificial discs you don't need the implants, because there are now surgeries that don't use these implants. That way we could fix herniated discs and back pain without the screws and rods. So just so everybody understands what I'm talking about, this is an example of the spine. These are two vertebrae. There was a disc here, and now what you can see in place of the disc is this gray thing. It's made out of PEEK, which is polyether ether ketone. It's kind of like a little plasticky thing, but it's actually made out of carbon. And inside that PEEK thing, which we call a cage, it's a PEEK cage, these PEEK cages are filled with bone graft from cadavers to promote fusion, fusing of this bone to this bone through this space right here. All right, now you've got also screws and rods. This is a rod. It connects two screws together, and these are called pedicle screws, okay? So you got one pedicle screw here, another pedicle screw here. If you look at it, you can actually see the screw going into the bone. It goes through this thing called the pedicle and sits inside the vertebral body. So you've got really 4 pedicle screws and a cage. Okay, that's what we have here, along with 2 rods, and then this thing here is called the set screw. And that set screw basically locks the rod to the pedicle screw. So this is an example of a lumbar fusion. And then, of course, you've also got cervical fusions, which happen in the neck. Can you see that? We've got a metal plate. We've got 6 screws bolting the plate to the spine by going through the plate into the bone. And then there are 2 PEEK cages there and there. All right, so now we've gotten some of the basic vocabulary down. Let's take a look at what these implants typically cost. So I've got here a spreadsheet that shows you some of these costs here. So let's look at the top. Alpha graft. This is bone graft. And basically per unit, which is about 5 milliliters, it's $1,625. That's what the hospital will pay to the distributor. The distributor is the one who does the sales for the implant companies. The distributor collects all the money, and then they pay the implant company. And unfortunately, in some cases, they pay the surgeon too, which they're not supposed to do because it's highly illegal to kick back money to the surgeon for using specific implants. And that's what we're going to talk about today, because the federal government in the United States just indicted a couple of people in one of these kickback schemes. And believe me, there are going to be more names released. They just targeted right now a spine surgeon who founded the company and was doing the kickbacks along with his helper, but they're also going to get the surgeons who were getting the money. We're talking millions of dollars in kickbacks for putting in, yes, screws and rods, doing spinal fusions. This is a big deal, and this has been going on for years. I've kept myself out of it because it's illegal. I don't do illegal things. But more importantly, you're going to find that this whole kickback scheme of surgeons getting paid extra money to the tune of millions of dollars for putting in screws and rods and spinal fusions, putting in artificial discs with total disc replacement, those kickbacks to the surgeons are what are driving all the spine surgeries to treat herniated discs with metal implants and biologics, okay? So look at the cost structure here. We've got the bone graft is $1,625. You've got set screws at $250 a piece. You've got one peak cage at $5,408, another peak cage at $5,408, and then a couple of more cages. So this is a price sheet for one of the fusions that I did. And I still do fusions. This was a 4-level lumbar fusion. And this is what we had to pay the company, the distributing company. I got no kickbacks. I got no money for it. I actually own the surgery center, so I wouldn't want to give extra money to them just to kick it back to me. It doesn't make any sense. But there are a lot of doctors, unfortunately, that are on the take. These are spine surgeons, and they're making a ton of money. So look at this number here. That's $55,030 in implants with screws and rods and cages for one patient's surgery. And this gets billed to the insurance company or the hospital. The hospital then pays that $55,000 to the distributor. The distributor then kicks money back to the spine surgeon illegally. And that's exactly what this article is about. So here we go. The CEO and CFO of Spinal Frontiers, they're a distributor for implants for the spine to do fusions and artificial discs. They were charged in connection with a kickback scheme in which surgeons were allegedly bribed to use their products in exchange for sham consulting fees. So the way they kick the money back to the surgeon is they say, hey, if you put our screws and rods in patients and you make us a lot of money, we're going to give you back a percentage of that money, about 10 to 20%. And we'll call it consulting fees. So you'll be our consultant. Honestly, there's nothing you can tell us that we don't already know, but we'll just sign you up as a consultant and put you on a retainer where you're getting kickbacks. Well, the federal government was onto it. Somebody alerted them, and now these guys are in trouble. Why am I bringing this up? Well, this is just one company out of hundreds that are out there that got caught. Other ones have been caught too. As a matter of fact, they're all doing it. And the ones that haven't been caught, they're doing it. They're just getting away with it right now. But this really isn't a discussion about surgeons making extra money and companies making billions of dollars a year. This is really a deeper discussion about who are the real victims. The real victims are the patients. If your surgeon is telling you you need an artificial disc or you need a fusion when you really don't, then you're going through that highly invasive surgery, extremely painful, long recovery for months on narcotic painkillers, opioids, okay? So you're going to be taking, after a fusion like this, you're going to be taking opioid painkillers for like months. And you can get addicted to those things. It could ruin your entire life. So why won't the surgeons, why won't they do what's right for their patients? Why won't they move off of implants-based surgery and move into more natural healing technologies like the Deuk laser disc repair? Deuk laser disc repair is endoscopic spine surgery. All right, it's done with a small incision. We go inside the disc and repair it with the laser. We leave nothing behind. There are no bills for artificial discs, no bills for metal, no bills for, PEEK, cages. There's literally all natural, nothing left behind in your body. And all of these fusions could be avoided if the surgeons were more responsible and were more focused on better patient outcomes, like we are here at Deuk Spine Institute. It's been nice talking to you. Hopefully you learned something today.